Okay, so it is Wednesday, April 15th. We're here with Health Officer Dr. Teresa Frankovich for her media availability. Thanks for being here.
Thank you.
We're going to start out just with the first question here. Some people believe the stretch of no new cases is partly due to less people being tested. Can you provide any context for residents as to why we saw multiple cases each day and then none?
Well, I think there are a few things we can talk about with that. One is that, of course, I believe our shelter in place has been effective. And so I think when I look at the number of community transmission cases, which is sort of my measure of the effectiveness of this, we have, we saw that substantial. We've had 7 to date. We have had minimal additional new cases in the last week. And so I think that is a marker of the fact that although we know the virus is out there, we're sort of frustrating it by keeping people from mixing and keeping the spread low. And so that's one reason that people can look at these numbers and one way to interpret that. I do know that when we look at this, the other factor that we had is we did have sort of a handful of cases right at the beginning who had multiple contacts. And so, of course, as those people were tested and were positive, we sort of had this, as part of the case investigation, we sort of had a rapid increase in number of cases. But again, I go back to the fact that I use that community transmission piece where there's no known travel, no known contact to explain the new case as my marker of what's out there circulating.
And is there an eventual goal to be able to test all of Humboldt County's residents for COVID-19? And if so, when would that be done?
Sure. So I definitely would like the capacity to test anyone who's symptomatic. That is not the case everywhere, and certainly not in Humboldt at this time. So we do want that capacity. So even those very mildly ill people, it would be interesting for us to know and potentially important in terms of surveillance. The other thing is, in terms of just testing people who are asymptomatic, usually that's done in a targeted way, so you get sampling. You don't have to test everybody in a population who's asymptomatic to have some sense of how much there is out there. And so I would love to be able to do that as well. And I'm hopeful that with the governor's task force on testing and the attempt to open up the supply chain and other assets, I'm hoping we'll have that capability.
Okay. And then Public Health Lab, the lab supervisor did a COVID minute today talking about that we'll soon have access to a new sort of COVID-19 test. So what type of test do we currently use at the Public Health Lab?
So our mainstay has been a test that sort of is more complicated, requires a lot of microbiologist time. We have to actually do an extraction phase of the test and then run the test, and of course that uses reagents and everything else. I've talked a couple of times about equipment we have on site called Gene Expert that has the capacity to run the test, and we've been working really hard on getting access to the materials we would need to do that. And that's looking more promising. So I'm hoping we're going to have some increased access to that as well. And that would definitely increase our capacity internally. It's not enough to do hundreds and hundreds of samples a day like you might want to do for surveillance testing, but it would definitely help us. The other thing is we actually were just recently successful in getting the state to provide a point of care test that some people have been hearing about in general. And this is a test that is meant to be in, for instance, a clinic or in a hospital setting where you are collecting specimens right there. It has a quick turnaround time of about 15 minutes for a test. But it's not meant to be a high volume test, So again, not something you can do many, many specimens on per day, but what it is good for are for things like a patient admitted to the hospital. Do we have concerns this patient has COVID? Someone who becomes much more ill, someone in an ICU setting, a healthcare worker. So having that capacity is really useful. And again, that has been limited by supply chain. So we've got the equipment now. We have to be able to get all the supplies to use it. But our plan is to place that with St. Joseph Hospital in Eureka right now. That can be accessed by other entities, but it will just help to augment our supply chain. The reason it's not in-house at the Public Health Laboratory in part is because, again, it needs to be where you're actually collecting the specimens to be most useful.
Okay. Is there a timeline for getting that?
Well, we have very limited number of tests with the original shipment of the equipment, so less than a dozen for sure. And we have an order in for additional supplies, and I think we'll be getting small amounts to start with. But then hopefully again, with the task force and some efforts around this, I'm hoping that that will open up more quickly.
Right. And then in reference to the gene expert testing, so would that be used in tandem with the test we currently use?
Well, there might be a mix of the two. Certainly if we only have limited reagents available for a while. Ultimately, in the best case scenario, my understanding is that that machine would allow us to do testing on the order of about 160 samples per day, which would be a marked increase in what we're able to do. And so we're really hopeful about that as another way to increase internal capacity. To be able to do that broad community level surveillance kind of testing that we're talking about, though, I think we really would need some additional assets. We would need either assistance from the state in terms of a mobile testing unit or some other technological help that would allow us to do that kind of increased testing. We can collect specimens, but we would have to have a large enough entity to run the kind of specimens you're talking about with that.
And of the 51 positive cases that we have, are any members of the homeless community?
Well, right now we're not reporting on the housing status of individuals who are diagnosed as a positive case.
Great, thanks. What is being done to ensure that COVID positive patients are staying in self-isolation beyond simply calling and checking in over the phone?
Well, we spend a lot of time with these patients in conversation between our initial contact and ongoing contact investigation as well as monitoring. So I guess my answer to that question is what we envision and what we've used is if there are concerns about someone's compliance with this order, we involve law enforcement. And that's sort of our enforcement piece of this order.
How many household individuals of confirmed cases who are sick but have not been tested do you suspect have unconfirmed cases of COVID?
Well, where we are in the pandemic, we are really making an effort to test everyone who is symptomatic and related to a case. That being said, there are a couple of unusual cases in which that just hasn't happened, either because there was such a cohesive unit of people who were positive that that assumption was made. But again, I would emphasize that for the most part, we are trying to test everyone just to confirm diagnosis. So it's minimal.
Okay. So a reporter wants to know if there's going to be another opportunity for the media to ask questions and follow-up questions like in the town hall style.
Sure. So I guess my suggestion would be, this has been evolving, how we communicate. So if there are concerns and needs, I just recommend people reach out to DHHS Media, the reporters, and talk to them about what their needs are. I would say for the general public, I would again recommend that they call our Joint Information Center at 441-5000 with questions, and that can be faith-based organizations, businesses, anyone who has a question is welcome to call, and we'll try and provide answers.
Thank you.
Thanks.